Okay, welcome everyone to this second part. Maybe I'll take that. And this part of the meeting is focused on sanitation, or wider wash and nutrition. And since that's the thing that's keeping us from our lunch, we will try to keep to time, and if possible, cut off 5 to 10 minutes. I hope I'm not promising too much in doing that. In terms of leading into the issue, I would just quickly like to begin with the history of SuSanA and wash and nutrition. It was 2 years ago here in Stockholm that together with others, the German WASH network, of which I'm the chair, 20 German NGOs did a seminar here on wash and nutrition. And the result, when we all sort of left the room, the question was, what can we do? And SuSanA was the perfect platform for bringing everyone together and to say, let's start a working group. So that was working group 12. And ACF is heavily involved in that working group, leading it. Stefan Simon, Arno Körver from Welthungerhilfe and Malteser International, 2 members of the German WASH network, those are the 3 co-leads. And now we're here 2 years later. I think at the last Stockholm event last year at Water Week, there were also wash and nutrition sessions. You see the topic really gaining speed. And this year we have a very special year because the World Toilet Day, of course, has the motto Sanitation and Nutrition. And there are a few seminars also during this week, a working group meeting that I think is already overbooked, but that we still entice you to come, and we'll make sure that the room capacity is used to its maximum. So this is sort of the block and the time that we want to spend on this. As you listen to the inputs and as we have our discussion a bit later, we do have a list here. I've signed my name to it because I'm interested to receive regular updates about the World Toilet campaign. So anyone interested in World Toilet Day, I'll pass this around. Please put your email address on it if you're interested in receiving those updates. That was one thing that I was just asked to do. And then this block will sort of have 3 parts. First of all, we'll hear about the special event this year, the World Toilet Day, and afterwards we'll hear sort of the current developments within the working group, within the sector from Jean, and then we'll bring Bella on board and have a small discussion, open it to comments from the floor. So I won't spend more time talking myself, but hand the word over to Lizette Burgers from UNICEF, who is head of toilet team, senior advisor, WASH. Please.
Hi, good morning. I will just give 4 slides, talk a little bit about World Toilet Day, which I'll give a little brief context because when I was in the field in India, Afghanistan, it's not always easy to understand what is the hoo-ha happening at the global level. So World Toilet Day was a UN initiative of the Singapore government and a Singapore NGO. We all know probably the name of Jack Sims, who is really behind that, and so a lot of credit should be given to him to get it on a UN agenda. And the 19th of November was designed as World Toilet Day in the context of sanitation for all through the unanimous adoption of a resolution by all 193 members of the United Nations. So it's just to indicate that it is at a higher level that there was an entry point to discuss this issue. Just as a little detail, I was in New York from 93 to 99, at the time that UNICEF nearly dropped sanitation because it was so difficult also to show evidence and results and the linkages to children directly. But it was until 2012 before the word excreta or sanitation was accepted at the UN in UN meetings. So just to give a little bit of, in some cases it's a political high level influential agenda, but it takes really some push to get it on. So the mission of, so with that date now set, the permanent mission of Singapore has embraced this World Toilet Day. It takes an active role. And this year, it will be the third World Toilet Day event on the 19th of November in partnership with UN Water, UNICEF, UNSCAP, but many other UN states, agencies, but particularly also of important civil organizations in the private sector. Now, the theme of this year is the sanitation and nutrition link, the health benefits. And so that is to raise international awareness to the scale of the sanitation crisis and the negative impact it has on children and their families and communities. So 3 different messages have been identified, or one core message, which is we can't wait for 2.4 billion people to gain access to improved sanitation. With 2 thematic messages to highlight the focus of World Toilet Day this year. So the first one is sanitation and nutrition. Better sanitation supports better nutrition and improved health, especially for women and children. And the second one is waste and innovation. We can realize the potential of human waste as a valuable resource to improve sanitation and nutrition through toilets and innovations. These messages reflect, of course, a big set of sub-messages, including stunting, safety, education, and more. But this is a kind of a compromise to get as much as possible simplicity, focus, and then the different groups can come in. Let me see. Sorry, I need to get to this. So there will be a flurry of activities during that day, before, of course, off and online on World Toilet Days. But all efforts will focus for access on improved sanitation for all, everywhere. A new website will be launched on the 15th of September, which includes clear messaging about this World Toilet Day, a link to resources, materials, news sections for members and partners, an ideas section for featured projects. For example, be a sharer, be a thinker, be an artist. Interactive maps of events around the world, and a toolkit with logos, posters, banners, and more. So the question is that if you have any resources to add to the resource section of the website, please send them on. Reports, infographics, videos, etc. We would like to really get all the materials and highlight the efforts of those around the world who are contributing to World Toilet Days. There is this new idea, or 3 new ideas for public engagement, which is that idea of being a sharer, an artist, and a thinker. So, for example, if you are SuSanA and part of SuSanA and you're a thinker, the idea is to show your support on social media by taking a photo in your thinker position and making it your profile picture, and then share the photo using the official hashtag, hashtag World Water Day, hash we can't wait. So there are several ideas. It's really at the moment in discussion also with the social media. And as technicians, sometimes we try to balance the technicalities and this desire to stay correct with that other group that is trying to gain more interest and get messages out that people can engage with. So then the UN event on the 19th of September, we will release a new report that provides an evidence base of the link between sanitation and nutrition. A first teaser has been out. It's expected to come out in the fall. So for people who want to have a small summary of what it entails. They can have a look at it. The details of the session are still being finalized and will be distributed shortly. The idea is to have the Deputy Secretarial General, of course, there with some people from the UN, but also to get people like, for example, Robert Chambers, NGO representatives and the private sector together in a debate. There are more issues in the pipeline, but we are waiting confirmation for some of the celebrities that we want to get engaged in, so to get more noise around that. So actually what I want to ask is, World Toilet Day is one of these moments that you can raise awareness about the sanitation crisis and to show how sanitation and nutrition are linked. That's this year. So the question is, please join us, strengthen the global call for access to safe toilets or to safe sanitation for all, and send your planned World Toilet Day activities and resources so that we can share it with the community. So you can have it sent to this website. That's actually all what I want to say. It's an opportunity to emphasize from a different angle also. So the nutrition groups, we would very much like also to have them on board and to bring in their thinking. And I'm very happy that to work with Jean. We're looking at how we can also strengthen that partnership to bring the messages stronger, how sanitation and nutrition is linked. I deliberately didn't go into detail about where the linkages are. I hope Jean will raise that a little bit, but it requires also much more time. Yeah, thank you.
Thank you very much, Lizette. I think while Jean is setting up his presentation, so I'm taking that there are sort of two main overarching connections we're looking at. On the one hand, nutrition that's being lost as people have certain health impacts that prevent nutrient uptake, and then you had the second part about sort of not only going in terms of nutrition, feeding people from the field to the plate, but also from the plate perhaps back to the field, or some sort of reuse. Okay, so we have those two elements. I think Jean will give us more insight into the connections, and also link it to perhaps what the working group has done in the past. Jean,
Thank
please.
you very much, Thilo. So I'm coming from holidays, but with my clothes, as you can see, and it's good because it's refreshing to jump in the bath like this. I'll try to make it not too boring, but just one thing: why did we create this working group 12? If you look at the WHO mortality.
If you're straying
Thank
from
you.
the mic,
Yes,
we'll
sorry.
need this.
It's better like this. Yeah. If you look at the WHO mortality under 5, and if you forget that 50% of the 6 million children dying every year die between 0 and 27 days, the perinatal mortality, the biggest killer of children is undernutrition. 47% of under 5 children die because of undernutrition. And the second bigger killer is the wash-related diseases, with 2.1 million children. What is quite interesting to see is that these two figures superpose one on each other. It's the same children. And that's why we created the group. You cannot achieve treating undernutrition if you don't prevent it by reinforcing the water and sanitation environment. Okay? So the working group has been created in 2012. And we will have the opportunity during the World Water Week to have two interesting events. One is on Tuesday at 11 o'clock in room FH201. And this will be a side event coordinated by ACF and the German WASH Network. It's here. Okay. All right, it's here. So you will find it here, and basically we'll have prominent people there. We'll have the Minister of Hydraulics from Burkina Faso. We'll have some very high institutionals from Germany. And the objective of this meeting is to move ahead looking at institutions, at operations, and at research altogether. Okay, so you're very welcome to come there. Then in the afternoon, on the Tuesday afternoon at 2 o'clock, room 353, you will have the working group 12, where we'll go in the detail of where we want to go, how can we proceed it. Okay? What is next? So Lizette spoke of the World Toilet Day. There will be also the Bonn meeting on the 11th and 12th of November. And this is hosted by the German WASH Forum, and SuSanA has a role as a host online, or what is it exactly, Thilo?
The conference will be exactly 1 week before World Toilet Day. We'll focus on bringing the two sectors together, gearing us up for World Toilet Day. And SuSanA will basically be the online host, reaching out, spreading the discussions that are being had there through the community.
Thank you. There will be also an opportunity to share our research on WASH and nutrition in the EEHF, so Emergency Environmental Health Forum of Nairobi. It's around the 15th of October. And there will be a presentation of the last researches done on the subject. Then the working group is also working on the publication. So we have a fact sheet that is on the website. You've got a lot of, and this is Lizette will share, of course, with you all this material, but we uploaded quite a lot of material on the website. And there are two publications. So the WHO USAID UNICEF one that Lizette just presented, and which is going to be a sort of a manual on WASH and nutrition. And ACF, UNICEF, ECHO is going to produce for April 2016 an operational manual. So you will have the Bible or the Holy Quran, it will be the WHO one, and then you will have the Gospel. You will have the basic manual to implement it at field level, so directly oriented to practitioners. In terms of research, sorry. And it will be my last slide. In terms of research, we still try to understand the connections between the WASH project and the sanitary environment, the infection, and the undernutrition, both the acute undernutrition, the wasting, and also the stunting, the chronic undernutrition. And basically where we've got the most problems is to characterize the connection between the WASH project and the acute undernutrition. This is a big question mark. Another thing is that we miss also evidence in sub-Saharan Africa. We've got many evidences due in particular to Dean Spear and the fantastic work done in India on the connection between sanitation and chronic undernutrition, but we still miss evidences in the link between WASH and acute. So ACF is developing research on that. Concern is developing also research on that in Chad. And basically this research will be available in 2016 and will contribute to push this subject. Thank you.
Thank you for that. We will go to a small discussion in a second, but before, just maybe for those first two presentations, are there sort of questions of understanding? I think you saw that Jean also has some other slides that he may give some more input on the issue, perhaps at the end, depending on how we run with time. But the point here was that we get these main statements out first, see if you have questions of understanding at this point. Otherwise, we would go into a group discussion, and then Trevor, please.
It's not a question of understanding, rather a question from our online participants that has come in for Lizette. It's not one on clarification, so I don't know if we want to reserve it. I'll just read it out and maybe we build it into conversation. So via Twitter chat, we have a question from Elizabeth van Munch, and she says, this is for Lizette. And it's will your team at UNICEF also be looking into improving the Wikipedia article on World Toilet Day and washing nutrition?
Just a very good suggestion. I will take it up. I will have a look at it. Thanks for that. I'll bring it back. We will look at that. Good. Done. Corinne says. Yes. Answer is yes.
The Wikipedia World Toilet Day piece is being updated. I'm not sure what the process is, but it's been written and submitted.
Perfect, good. And this shows that our linking outward with the video and through through social media works. So thereby also encouraging others online to post their questions, because we can bring you into the discussion we'll have in a second. Now you see in your program that I would like, first of all, I would like our two speakers to please come to the front again, and I would like to add Bella to the round. The reason I'm bringing in Bella is because, on the one hand, Bella Monse from GIZ, working with Fit for School, and we were thinking beforehand, this is a challenge to really bring together two silos, to bring together different sectors. And I think Bella is an excellent example of a person who has done this for years, working with different sectors, with the education sector, with the health sector, and that list could probably be continued, bringing different aspects together. The second being that you have a very specific sort of stakeholder group. Yeah, you're seeing sort of a small part of the whole picture, but that very detailed at schools, which are obviously very critical places for impacting society with either new trends or also with the connection of wash and nutrition. So first of all, I'd like to pose a question to you, Bella, and I'll give you the microphone, just to ask whether, first of all, if you have experiences from your work that you would like to share, where you see this link actually happening, taking place, where you see evidence of this, and secondly, maybe to sort of comment on the opportunities of this year and what's going on and how you view that in a greater picture.
Thank you very much for inviting me here. I'm working on school health in the area of water, sanitation and hygiene in schools, which is institutionalizing hygiene habits into everyday school life by institutionalizing hand washing, institutionalizing toothbrushing, and also biannually warming, but also institutionalizing taking care of toilets in school and institutionalizing cleaning and maintenance as everyday activities in school. Of course, that is not something which is very natural to the education sector. This is very new for the education sector, and there's also quite a bit of resistance sometimes within the sector, thinking this is work of another sector. And of course, with these activities, you try to reach health goals. You try to reach improved health, and you do that. So within the school is sort of a microcosmos where different sectors come together, but everything goes through the education sector, because the education sector is calling the shots in schools, and it can never, every program will fail which will not go through the education sector, which is just in a way hooked on schools, will not work. It has to go with the system in the schools. So that's my background, and when you look where are areas where you have really the connection, then you can say you have it in the area of water. Access to safe drinking water is, for example, a perfect thing which need to be in the school, which is part of hygiene and part of nutrition. Yeah, you need water, sanitation, hygiene, you need safe drinking water, and it's part of nutrition, but you can also perfectly link that through existing school feeding programs. And a good example, for example, is the government of India, which is doing school feeding for all their 150 million children every day. And now they're integrating daily hand washing prior to eating to the kids so that they will eat with washed hands, but also put that as an example, put that as a need for the people who prepare the food. So that's also where hygiene comes together and where the school is a perfect place to institutionalize that. Sorry, that was long, but...
No, perfectly fine. And concerning where do you see the huge potential that this year might bring? Are there any suggestions that you perhaps might have either?
Yes, maybe what is interesting with school is that it's a microcosm where it's a perfect place to share messages and to share good behavior, but it's also a perfect place to share contamination. And it's places where there is wash contamination also. Yeah, the SDG, I think, are highlighting the need to ensure infrastructures in schools. This is a great opportunity for all of us. I think we should surf on that.
Yeah, maybe let me reflect a perspective from the field that came from Indonesia. I mean, there's a lot of talk about the evidence of wash interventions on nutrition, wash, also on every mother, every newborn. I mean, there is an increased interest in the evidence building. But one person, Aiden from Indonesia, recently said it's also probably, I mean, let the discussion on the what, go on. We need to know what is the evidence. And the emerging evidence shows clear linkages, but it's growing evidence, I would say. But there is definitely a need on the how, and that's why I'm also looking at Jean, that we're really looking forward to a practitioner's manual, and probably more evidence on what can be done. And therefore, it's very important to understand also the context in which different programs operate. So what somebody this morning said, we were usually preaching for our own parochial constituency. So we preach to the converted already. And we need to, if you want to work in wash in nutrition, same as you do in wash in education, or wash and nutrition, or wash around midday meals in schools, makes it even more interesting. You need to understand what is the context, what are the national programs, where is your entry point, is there, for example, in nutrition, an infant and young feeding program with manuals and guidelines, and are there ways that you can get in your basic messages apart from having the issue addressed for the facilities, but to look really at the entry points and to make sure that if there are meetings around, and that makes it also a little bit more challenging. We are also having a challenge to be in all the water and sanitation meetings at the moment. But if you want to have a real integration, you need to show respect to the other sector, and you need to know what is the national planning, what are the national programs, when are the planning meetings, who are the key players, what is the network here, where is the influencing happening. And one thing I learned, and somebody said about failing, you need to have human resources there. You need to have people who understand the language, who are willing to invest time, and then publish and document. Just that's a little reflection.
Regarding the integration of sectors, it's one of the pillars of the Wash in It strategy, and it has been already endorsed by different movements, for example, the SUN movement. So the SUN movement is 59 countries today who are involved in trying to develop frameworks, political frameworks, in order to connect the different sectors and to identify all the causal analysis of undernutrition. So the WASH is definitively part of that.
Okay, and the SUN movement is scaling up nutrition. Yeah? We have a few comments from the floor, so I'd like to bring those into the discussion.
Thanks. I agree and support everything that's been said, first off. Secondly, just to add to Lizette's comments in terms of the linking at a very practical level, I'll share our experience over 10 years in providing training and having it integrated in the training. So when we're training health practitioners, we have incorporated in it the basics on water and sanitation, demystifying the whole arena. And likewise, when we're training technologists and engineers and the technical practitioners, we're incorporating the basics on microbiology and epidemiology. And what we find, and we're talking at the very practitioner field level, is that when the people who are implementing have the information, they make better decisions. So it's not necessarily, and I'll share one anecdote from a conference I was at last year where it was the conversation it was the World Bank and the UNICEF saying we have to push down the conversation that's happening up at the top level, so to speak. And I would argue that exactly, is that when a health practitioner knows that they can take action on water or sanitation, hygiene tomorrow, they start doing it. They implement it into their decisions. And likewise, so do the wash practitioners. When they understand that chlorination isn't going to take out cryptosporidia, they take a different decision.
Can I just endorse that with an example?
Yes, please do that. And I'd like everyone else to also think about practical things that, because we'd like to probably summarize this session with practical things that SuSanA, what can we do together to highlight this?
Yeah, I just want to endorse what you're saying because, and let me go to healthcare facilities. In Dakar, at the Africa Sun meeting, there was a session on water sanitation hygiene in healthcare facilities. And there was one very respected, highly respected, and really appreciated speaker who honestly said that Sandy Cairncross, who many of us know from the London School, had asked for many, many years to establish the link between poor water sanitation hygiene conditions in healthcare centers and with maternal and newborn health. And she had refused. It was a head of the maternal healthcare or the maternal health in one of the respected universities, and she had refused for several years. She said, look, this wash sector wants to look now at everything. And then she was waiting for one grant to come through, and she said, let me look at it. And she said, it still gives me the chill. And she gave some very excellent slides. Unfortunately, I lost my hard disk, so I don't have it with me. They are recuperating the data, hopefully, inshallah. But there is a presentation out, and I can try to get it for you, that really showed the linkages, and it's not that's at the higher level of the academic level, and this was also a result because WHO, UNICEF, and other partners, UNC, they started to look at what is the data out there. So it links it a little bit with the discussion this morning, JMP, and at the local level, what data do you have available? I just want to emphasize that you cannot wait. You need to push also the academia on the higher level to look at what is happening and to show that there is a link. But sometimes it takes more years. And in the meantime, we need to get our act together at the practitioners level.
Okay, a few more hands. The one back here, then I'll go online again. Who was first? I think the hand back here somewhere was first. I think yours was first.
Thank you. Yes, my name is Antoinette, and I'm from SNV, Netherlands Development Organization. I think you're very right that the work on the causal links is important, but that we also need to talk about how. And I think that if we talk about how in terms of integration, that is really very confusing, because it assumes that it's a merger. Whereas I think there will always be things in WASH and in nutrition that are outside, things in WASH outside of nutrition and things in nutrition that are outside of WASH. So I would like to see that circle, that partially overlaps. And in our practice, two things that we're really struggling with is that nutrition sees their priority target group as mothers and children and not as a entire population. So they define a target group of a program across many districts over a huge geographical area. But for us to make results in sanitation, we need to work with local governments and trying to work on sanitation systems in an entire area, which they feel is a little bit outside of what is relevant. Yeah. The other thing is that I'm struggling with when you gave the example of the extension worker is that in my experience, health extension workers have so many modules that they already need to do. And it becomes like, you need to, right? And we've learned in BCC that it's important to prioritize, to do one message, to phase those messages, etc. Now, just adding messages, that is undermining that earlier insight, I think, that we really learned in BCC.
Thank you for those comments. Jean's put up a slide and you can comment as well.
A brief answer on that. What is magical with Wash in Nut is that you don't need, you are not asked to do new things. You are asked to do the same thing you were doing, but to do it in another way. For example, so basically here you've got the 5 pillars of the Wash in Nut strategy. The first one, focus your wash intervention in areas where you have high malnutrition rates. This is a pure strategic decision. You're already doing wash activities. If you focus these activities in areas where you have a high prevalence, then you will impact on nutrition. So it's not doing something new, it's just doing it differently. The issue of the minimum package, we want to be sure that at all the levels of the society, from the household to the, let's say, the public health centers, there is a minimum standards of wash. And this, you are also doing it. But of course, it's a more comprehensive framework. Something very important also is to focus on the dyad between the mother and the child. There are enormous connections on that. You know, for example, that a woman who's got a low weight is going to produce a child with a low weight birth who is going to fall very easily in undernutrition. So it's not to look only at one person, but it's to look at the couple, mother, child. Behavior change and all the soft approach of WASH is essential. But this is also opening an opening door. I mean, we all know that building a latrine will not change the world if the person doesn't know how to use it, or doesn't use it, or doesn't want to use it. And finally, we need to improve our coordination, intersectoral coordination. It's exactly what Lizette was saying. We are not working in an isolated silo. We are working in an integrated framework, and we need to keep that in mind.
Yeah, maybe to add on that, I think it is so important to understand that the different sectors use different languages and have different objectives and have different time frames. And it's extremely important to look and to work at the interface. And it's not only wash and nutrition. Same is health, same is governance. We heard that this morning. Same is education. So the interface is very complex, and it's a challenge how to address that. And I think most important is to come up with very, very simple approaches. Nothing what is, the issue is complex, but the genius thing is to develop approaches which are very, very simple and everybody can agree to, so that people can step in from the other sectors and that you don't close the doors. I think that is quite important.
Just to endorse Antoinette's point that you need to have strong sectors. Some elements you need to invest in understanding each other's sector. But I'm not advocating for a convergence of all the sectors in one program. I just come from Afghanistan, where I actually suggested to have the water and sanitation section from UNICEF not integrated in health or education. And why? A simple one. Everybody, or many of us, probably are familiar with some level of the Asian-French fusion kitchen. If you have had a very nice meal, I mean, you really get excited about that. What does it require? A very good knowledge of the French kitchen, a very good knowledge of the Asian kitchen. And then you get an incredible menu. It can be done. But if you just take a little bit of both, you get maybe a soup, maybe a salad. You may be lucky one time it works, one time it doesn't work, but you cannot repeat. So I'm saying know your sector, but start to really understand the other sector. Start to understand what the challenges are of a health worker or a nutrition worker, and see where the opportunities are.
That is such a nice lead over to lunch, but you could just see everyone sort of begin to drool as you're speaking about this food, and everyone's. But I did promise before we take one more online question. So in order to really make use of the people watching, listening.
Well, that was also a nice thing that Bella actually, her last statement actually answered the question. I'll just read the question out, but Bella, you don't need to repeat because you've already answered it. The question was to you, and was to say, what advice do you have for other countries of how better they can connect WASH to the education ministry? You've already answered that. Great answer, and I think lunch is not too far away.
Okay, so not only have we had this teaser that leads over to lunch, I think you see there's much more to this topic that needs to be discussed, and I hope this was a great teaser to get all of you to come to the seminar that's taking place on Tuesday at 11. Please do come to that. Bring others that you feel would be relevant to this discussion, and then we will carry over to the SuSanA working group meeting, which is then on the same day after lunch. So it's very close together, and thereby I hope I can sort of justify cutting this discussion so short, because we'll have plenty of time on Tuesday to discuss that in detail. Trevor is showing we want to do a group photo, so before everyone sort of runs off to grab a bite to eat or runs to the restrooms, where do we take the photo? Where do we meet? How do we coordinate? Yeah, in the corridor? Okay, so a round of applause, please, for our panelists.